The next speaker is Dr. Amritanshu Ram from HCG Bangalore Institute of Oncology, Bangalore. And his topic is role of yoga in cancer survivors.
Thank you very much. I am Dr. Amrit. I've been working with Dr. Raghavendra and Inbaraj and the entire team now. First of all, thanks to all our oncologists who have had great faith in us to be able to understand the approach that we have taken to yoga, looking at yoga and yoga research, right? So in a truly agnostic way, as soon as like some of the doctors ask and many of the other people ask, as soon as we say we're going to do a yoga, they ask which school do you come from, what kind of yoga are you doing? And in a very purely, completely agnostic way, it is a effort to try and bring it back to the basics, bring it back to the scriptural understanding of yoga combined with physiological effects, build the evidence from there, and then come to the clinical impact of a particular practice or a particular intervention that we are planning. Today, the topic that I've been given is yoga for for cancer survivors. And I'd like to take a minute to understand who do we classify as a cancer survivor, right? Is it just, I know NCI and NCC and definitions very specifically limited to only the cancer patients beyond their period of active treatment that is there, whereas impact on who, right? So when we are looking at who does cancer impact, and it's not very limited to only the cancer patients, but also the primary caregiver of that particular patient, the relatives of that cancer patient. We had one very nice statistics that was presented recently. In the earlier days, if you ask non-diabetics to check the box that how many of your relatives are diabetics, right? Very few people would check that box, which implied that I had a risk score reduction of lower risk score of 1. Whereas nowadays, because of no fault of mine, right? Many of my relatives are diabetic. So for absolutely nothing that I have done, my risk score is increasing by 1. So similarly, the relatives of cancer patients, when I'm looking at a hereditary value, right? My nieces, my nephews will report that I have had cancer and therefore they are at risk, right? So being impacted by cancer is not purely limited to the person having cancer alone. Also friends, and more so the caregivers, the nurses, the doctors who take you through that journey of entire cancer, we know and we understand that there is a tremendous impact on them. Very quickly, just running through very quick statistics, we understand that in 2050, there's going to be a large number of elderly Indians, right? There is going to be almost 149 million people beyond the age of 60. Another interesting statistics is that cancer is going to increase by 77% in the next 25 years, right? This is again the WHO statistics that is there. And in combination with this, we see that India's mortality rates are very much similar to the mortality rates abroad, right? Whether you take many of the other countries that are there, whether you take United Kingdom, USA and Japan, and this is information that we have picked up. So India's mortality rate is far lower as opposed to, is similar to many other mortality rates of developed nations. So essentially we are going to have this trifecta of population itself increasing, the number of cancer diagnosis increasing in combination with lower mortality, having a huge number of people who are cancer survivors, right? So we need to have effective treatments or effective management of cancer survivor for them, effective interventions so that they are less of a burden to themselves, they are less of a this one, and they have a better way of living. Another interesting study that we looked at, another interesting fact that we saw was that in PubMed, if you Google cancer survivorship today, you find in the past 25 years, you find that there are about 4,000 papers that have been published. But I'm just moving to the next slide. Only 400 of them are actually level 1 evidence, right? So the systematic trials, meta-analysis, or control trials or randomized control trials all put together only form 10% of the entire evidence. So my point is, we are still not up to speed in trying to look at what we are doing with cancer survivors. So very quickly, I'll go through two of the studies that we have done in cancer survivorship. And one of the study we looked at comparing a group of breast cancer survivors who have done yoga before versus who have not done yoga before, right? It's a very simple study. We look at approximately 30 patients who have done yoga before as part of their cancer support group, as part of their cancer therapy. Oncologists have advised them to take up yoga sessions. So we screened for all matched, for age, for all matching, for the type of cancer that they had, the stage of cancer that they had, the kind of treatment that they underwent. When all matched, and the only differentiator that was that during active cancer treatment they did yoga or not, right? And the idea that came about was that once you know how to fix the circuitry in your mind, right? Once you know through yoga how not to be anxious, so it's like riding a bicycle. As soon as you know that, okay, this is a situation where I'm potentially going to get stressed, but I have the tools and mechanisms that I don't get stressed, and I evade that stress mechanism, and that becomes a lesson for life, right? So that stays on even during survivorship, and that impacts even the way I live going forward. And we noticed that for all the psychological variables that we looked at, including general health, stress, anxiety, depression, quality of life, and various quality of life domains, there was a better psychological milieu, so to speak, in those that had actually did some kind of yoga interventions before. What was interesting to note was that we looked at pro-inflammatory, anti-inflammatory cytokines along with this, right? And we wanted to look at whether having a better psychology, a more positive psychology, will actually create a immune milieu also that correlates with this. And we did notice that the general pro-inflammatory activity was much lower, the general anti-inflammatory activity was better. And two of the very important things that we found was the NF-kappa B, which is related to almost, and everybody who is a researcher here in anything to do with the NF-kappa B pathway will understand that it has a wide reach on all the various inflammatory pathways that it can influence, right? There was another interesting protein that we found, which is called as the monocyte chemoattractant protein. And digging a little deeper in the MCP1, we realized that this is a site where the monocytes start to aggregate in a location where there is potentially going to be a recurrence, right? And the MCP1 is like the immune, it starts gathering the monocytes over there for a potential place where there is a precursor of inflammation, which potentially is going to be a new place of recurrence. And that we noticed was also much lower in the group that had done yoga. So potentially the systemic milieu that creates a recurrence also might be put forth. This was the second study that we did, and the understanding of this study comes from the idea that there is a continuum of health, right? We believe that there is a disease state, there is a normal state of existence, and there is a yogic state of existence, so to speak, or there is an evolved state of existence, or there are people who are going to be super healthy, so to speak, by doing yoga, by doing corrective practices, by doing mind-body interventions. And we looked at two contradicting parameters, right? One is the amount of DNA damage that is there inside the system, right? Regular peripheral blood, and the amount of apoptosis that is there, right? So apoptosis was measured using the single cell gel electrophoresis, whereas the DNA damage was measured using the COMET assay. And opposing ideas that the amount of the quantity of DNA damage that is there versus the amount the body is able to program itself for cell death, programmed cell death, or which is a corrective mechanism in the entire body. So what we noticed was in the disease state, there was a normal level of, so this is amongst breast cancers, there was a normal amount of apoptosis, and there was a, there was a high amount of DNA damage, sorry, and there was a normal amount of apoptosis. So that means the apoptotic pathways are trying to keep up with the amount of damage that there are in the system. This is in the disease state, which is expected because patient is having a active metabolic crisis in the body, which is making the system trying to cope with it. If you look at the normal healthy group, you will see that there is a high amount of DNA damage and there is a high amount of apoptosis. So the corrective pathways are able to keep up with the destructive pathways and create a balance or maintain a balance. What we didn't expect was what we saw in the group that did yoga, right? So we looked at, these are all women again. So the disease group was breast cancer survivors, breast cancer patients on active treatment. The healthy group were those who never did yoga before, but those who were healthy and did not have any other comorbid conditions. And positive health were those who were doing yoga for at least 10 years, right? So those were ideally people who have positive lifestyle practices, etc. And what we noticed in this group was that there was low DNA damage to begin with, low apoptosis, right? So the body was not damaging itself for it to be repaired, right? So is this a new normal that we are trying to create, right? And this care continuum, this lifestyle continuum of whether by doing positive lifestyle practices, we are able to bring about a new physiological normal, which does not damage itself, which does not require that amount of upkeep, right? So these were just the two studies that I wanted to mention as part of my talk on survivorship today. The idea behind this is very simple, and yesterday Dr. Nagendra also spoke about it, is that this is all coming out of the mind, right? So whether it be what we talk about chronic inflammation, the HPA axis, all of these are all coming out of the mind, and from the time we start with, so the theory is when in the Anandamaya Kosha, right, or in the blissful mind, the blissful identity that we have, there isn't actually any disturbance at all, right? When we come to the Vijnanamaya Kosha, we start having thoughts. Those thoughts turn into emotions, and the emotions gather tremendous amount of speed by which we lose our control and create that physiological mess of dysregulation that we are experiencing. And through yesterday, we've all learned that the epigenetics, the genetics, the cytokine, immune milieu of the entire body is definitely affected by various network of factors that we are still yet to understand. So just to summarize the entire study, I'll not take too much time on this, but we have seen that a lot of the things that the patients benefit with yoga therapy during their active treatment is something that they will also benefit with during their survivorship also, right? So there were a lot of therapies that we looked at and published, like Dr. Raghavendra was mentioning, about cortisol rhythms, cytokines, DNA damage, along with trait anxiety, depression, etc., which are all various different components of the individual, right? Some of them target the physical activity, some of them target the mental activity, the pranic layer, the Vijnanamaya Kosha, the Anandamaya Kosha, so on and so forth. So I want to mention over here, India has a problem of malnutrition on the one hand and malnutrition on the other side, right? So we do have people who don't have the next meal, but also people who are overeating at malls, right? So malnutrition to malnutrition. And there is a beautiful shloka in Bhagavad Gita which talks about how to fix this problem, right? So there is yukta ahara viharasya. How many of us have already heard this, right? Yukta ahara viharasya, yukta cheshtasya karmasu, yukta swapnava bodhasya, yogo bhavati dukha, right? What does it say, right? There is a very beautiful word in all of this, is that yukti, right? What does yukti mean? Yukti means intelligence, right? Tempered, temperamental, right? So you have to figure out what is right for you, right? And what is it that you're looking for? You're looking for what is right for you, what you eat. You're looking for what is it that your physical activity is, what are your sources of entertainment, right? What is your level of sleep? So when it comes to these trifecta problem, right? I'm sure every clinician, everyone who deals with patients understands that the three problems of the current lifestyle is a combination of physical inactivity, stress, and hypernutrition, right? So we are looking at those being an etiological cause for various different lifestyle disorders, non-communicable disorders, etc., right? And as I said, there is a whole a journey that the entire patient goes through, and the earlier we intervene, the earlier we look at what are the corrective actions, the earlier we are able to prevent problems, the earlier we are able to fix those problems. So what do I do about my survivorship, right? So we've covered in our first slide that probably everybody here is a cancer survivor in a way, right? I fall into one of many buckets that it can be. I can have a relative that I cared for, I can have a relative who I did not care for, but I still know about, right? I might be a caregiver, I might be a patient, right? I might be a survivor myself, right? I might fall into any one of these. So what do I do to fix my survivorship issues, right? So one definite thing is risk reduction. And we have seen since yesterday that 75%, 70% of all the risks of cancers are invariably modifiable. Only things like I can't change my age, I can't change my ethnicity, I can't change, but a lot of things that I can change, and let me do that, right? The second thing is primary and recurrence prevention, where I look at ways to detect early, detect not just the primary early, but detect also recurrence early, so a good follow-up, right? And also bring about a beautiful lifestyle change. There was another one interesting point that was there, was that how I perceive my treatment. If I take my treatment that, okay, I will take it on and I will fight the cancer, then studies have shown that my outcomes are better. As opposed to if I say, oh, I've got cancer, I'm going to give up, then studies have shown that the outcomes are far worse. And finally, what do I do during my survival, where I look at this? I invite everyone to please help build evidence, right? I think this is the only bottom line that we have, and we've been able to do this by way of creating this data, by way of generating data around this. So whether it be in a purely clinical setting, whether it be in a research setting, please get into the habit of collecting data from the patient, right? And this improves our understanding, this improves our understanding of the various different relationships that are there. And I invite all of you to please come over at HCG and understand how we do in a multidisciplinary setting, how we look at the onco rehab program that is there, right? Thank you so much.